as a bedside nurse, this care pair model is very awesome just because we have working like very efficient and effectively with our patients though, because one advantages is you have one care tech with you, which is you could just go in to give a report for one CNA, and then you could delegate all the tasks that you need to do for the entire shift. You're not going to be worried about that task that needs to be performed, like for example, your bath, your repositioning, your blood sugars. Those are always on the dot that is being done by our CNA. So with this care pair pilot, we really like working efficiently and effectively for our nurses.
I like to just have one nurse to get report from, and only having 5 or 6 patients is really nice and helpful because I like to spend a lot of time with my patients, and I know a lot of the other CNAs that work here do as well. And getting to know them and being able to focus on like hygiene and walking them in the hallways. Like, it's nice to have one person to lean on that you know has your back, and you're all working for the same goal and for the same patients. Yeah, it's really different. It's nice to, you know, only have 5 or 6 patients instead of having, you know, 15 or the whole floor. And like, it's just so much easier and better for everybody.
When they're not in the care pairs, they have 12, 15 patients. So when you boil it down to just 5 or 6 patients, they got to take time to take care of their patients. You know, they didn't have to go into a room, get everything done, and then go to the next room. They could take the time to get to know that patient, take care of that patient, brush that patient's hair, or take the hour to give them a bath, just kind of settle them. It really showed the staff satisfaction and patient satisfaction of it. And ultimately, that collaborative effort and two-way communication between the RN and CNA allowed for patient safety and just that teamwork piece that we're looking for, ultimately to ensure that, you know, all of our patients get the care that they need. And as a whole, we saw both patient experience slightly increase, and then also our quality data. You know, we have a big focus on ensuring that we're preventing infection, and so making sure our patients get their CHG bath every day. And actually, post day 1 of the actual pilot here at Bellevue, we saw a 10% increase in our CHG bathing scores.
I feel like it is way different. Like, you could, you know, you could spend time with them, but not forgetting what are the important tasks that you need to do with your patient as well.
For like new CNAs coming in especially, I think that this is a good start for them, not taking on like too many patients and having this great team to lean on. By seeing everything, it's really like motivated me to want to go back to school and become a nurse and do stuff that these guys do. So, and it's nice because we feel comfortable asking questions to them, and because we work so closely, and yeah, so I just love it.